Board of Health meeting for August 8th, 2022. And then if you want to do a roll call, that would be great.
Mayor Condrey?
Here.
Mr. Richmond?
Here.
Ms. Cash? Ms. Zipsey?
Here.
Ms. Lawley?
Here.
Mr. Bonnell?
Here.
Dr. Zollett?
Here.
Do we have a motion to excuse Ms. Cash?
Sure.
All in favor? Oh, wait, we had a second. Did we get a second? I heard
Second.
Jeez. Okay. All in favor?
Aye.
All opposed? Okay. Hopefully she'll still show up. But, okay, any citizen comments today? Okay, not today. Minutes. Do we have a motion to approve the minutes for July 2023? Via motion?
Second. So move.
Second.
All in favor?
Aye.
All opposed? Okay, we have the financial report for July of 2023. Do we have a motion to receive and file that?
So moved.
Second.
All in favor?
Aye.
All opposed? Okay, that brings us to an education presentation today, Mosquito-Borne Illnesses in the United States by Dr. Genline, who apparently got up even earlier to vote.
I did.
Wow.
That's what I said, that was
Whoosh.
impressive, huh?
Here's my button. So, worldwide, mosquito-borne parasites are a significant problem. You've got protozoa, which is malaria, bot flies, which are kind of everybody's worst nightmare, where it's not actually spread by the mosquito, it's eggs laid on the mosquito, and then when the mosquito bites you, the eggs land on you, and then little larvae dig into your skin and eat your flesh and grow inside you until they spring out as the bot flies. Yeah, it's a pretty bad one. Luckily, that's not in the United States. Helminth, filariasis, or elephantiasis, again, not in the U.S., and then viruses are the biggest one.
Excuse me for one second. They just found, I was watching TV last night, they got cases of malaria in Florida.
That was the whole point of my presentation.
Oh, I'm sorry.
No, that's quite all
I'm
right.
sorry.
You
I
stole
just-
my thunder.
Oh, okay. I'll
So,
I'll
and
keep
it
my
even
mouth
gets,
shut.
and the part of this gets even closer to home.
Yeah, that's what.
So in the United States, fortunately, we don't have some of those truly nasty ones, but we do have quite a number of viruses that do create some significant diseases. Most of them are quite rare in the US, and are very small outbreaks when they do happen. Most of them are things people contract when they're traveling. They catch them in another tropical or subtropic region, bring them back here, and then get sick here, get diagnosed, but there's no spread from mosquitoes here. But, you know, there are some that we're all gonna be familiar with as we go through: West Nile virus, Zika virus, the one that I practiced about 20 times last night, still struggle to pronounce, but chikungunya virus.
That's good.
So, and then protozoa, we do have malaria cases that do occur, but again, almost always those are travelers coming into the US from somewhere else that is more endemic of the disease. So transmission, obviously the mosquito has to get the disease. So it bites an infected person or animal typically, and then it has the parasite inside of its system. The mosquito, interestingly enough, has its own immune system, of course, which is trying to kill the parasite. So it's almost a defense for us even. So it's a very narrow window for us to get infected, because the parasite, it had to have contracted it early enough to not have killed it itself, and then bite us again to spread it to us. So when the mosquito does then bite a human or another animal, it injects saliva and anticoagulants so it can suck our blood and doesn't coagulate. And in injecting that material, it injects the parasite into whatever it's biting. Then the animal becomes sick and contracts the illness. If it gets bitten by a mosquito while it's sick and before it's defeated the illness, then the whole cycle starts over again. So the symptoms of pretty much all of these diseases, unfortunately, is almost identical. Non-specific flu-like symptoms. So whether it's the viruses or any of the viruses we're going to list, or even malaria, it's fever, body aches, muscle aches, headache, chills, nausea, sometimes diarrhea, a very non-specific illness that really, again, travel history has to come into the history of where have you been, what have you done, why are we gonna think something other than just a common viral thing. If it gets severe enough, you're getting into meningitis, encephalitis, you'll get significant headache, neck pain, confusion, and obviously death could result at the end if it's severe enough. So the number one virus that we deal with here in the United States is the West Nile virus. It was first seen here in 1999 into the summer of 2000 in the Northeast, spread across the United States over the next 2 summers and peaked in 2003. It essentially was a virus our bodies had never seen in the US, so it spread quite quickly. 80% of people who contracted are asymptomatic. So you don't even know you had it, keeps it kind of moving in the system. Of the 20% left, the vast majority of them are mild symptoms. If you're over 60, you do have the risk of getting pretty sick from this, getting a significant encephalitis, confusion, and even some cognitive decline that is not recoverable after the illness. This virus affects humans. Humans, horses, and bats are the 3 common themes throughout it. And interestingly enough, most of the mosquitoes can't contract these viruses from us. They have to get it from the horse, but then can spread it to us. So the big one in public health they're always looking for is mosquito pools, testing for mosquitoes, but also watching birds and what's coming out with birds and who's infected with those. So then equine encephalitis is actually 2 eastern and western. Extremely rare in the United States. There have been small pockets that occur with local spread, but again, most of it is a travel acquired. Again, humans, horses, and birds. This one actually can contract from the human back to the mosquito, and it is by far the most serious ones. It has a 30 to 60% mortality rate if it gets into a severe disease, but again, it's extremely rare in the US. The Zika virus was again usually Central Africa, but in more recent years has been found in Central and South America, and most recently into the Caribbean. There was again, usually travel cases, but there was a recent outbreak in southern Florida. It typically, again, is very mild and no symptoms for most of us. The big thing with Zika was it is transmitted mother to fetus and can create severe birth defects, microcephalus, and commonly death in the fetus. So it is a very serious virus in pregnant women, but again, it's pretty rare and uncommon in the US. Chikungunya and dengue fever, again, extremely rare as far as endemic spread in the US. It is travel related, tropics. Again, it's a human to mosquito one of the few ones that can do that. Pretty typically mild illness from them. Not much to say with them because it's so rare. Malaria is the big one. Plasmodium species, there's actually 4 species of the protozoa that causes malaria. If left untreated, it has up to a 20% mortality, 600,000 deaths worldwide estimated annually. So it's a huge problem worldwide. In the US, it really has been viewed as solely a travel diagnosis. So there's 2,000 cases annually in the United States, but almost every one of them always is someone who's traveled to an endemic area and brought it back to the United States. Still has to be diagnosed, figure out which protozoa species it is so you can target treatment for it. There is treatment, obviously, quite good treatment as long as it's caught early. But this year, which hasn't happened in over 20 years, there were 7 cases in Florida and 1 in Texas where those 8 people had not traveled anywhere. So someone had traveled somewhere, brought the protozoa virus back, mosquito bit the human, then went and bit somebody else. So it was local spread within the population. In my research there, it says, interestingly enough, most of them are kind of congregated around the local airport because people who travel, come back, and they're in that city where the big airport is. So it's been a long time since we've had any local spread of malaria, and urgent treatment is required because of the high mortality. So you've got to have on your radar, for most of us physicians, you're thinking the travel history, but here again, you've got some pretty astute physicians who recognize the disease and, even without a travel history, knew to treat these patients. So treatment with viruses, as usual, there's really no good antivirals for any of the ones we've talked about. It's supportive care, fluids, fever-reducing medications, antipyretics, so for nausea and vomiting, just keeping them healthy enough to survive and recover from the virus on its own. Malaria, there's very good treatment depending on the severity of the illness. If they're mild and early, you can just do oral medications, depending on the species of the protozoa. And then if they're severe, you've got IV medications, IV fluids, ICUs. You've got to be careful with its treatment because of resistance to some of the older medications, depending on which part of the world the traveler was from or the protozoa is, depends on the drug you choose. In the US, it all really has come down to prevention. Ever since the 60s and even back to the 40s, they had huge campaigns for draining standing water, swamps in Florida and swamps anywhere. I mean, but still today it's, you know, Carla knows to go out and get these local areas to not have standing water in tires and junk in the yard and things like that that are just breeding grounds for mosquitoes. Still today, there's a lot of people you see don't cover the doors and windows, keeping mosquitoes out of the house. And then the repellent. DEET is up and always the big one we've all heard of, 20% or more. Picaridin is a relatively newer one that's as effective, arguably less problematic than DEET, and has really been kind of catching on and taking over as the best repellent. And that is my presentation.
We used to have to take anti-malaria meds when, like in,
Oh, yeah.
I was in Afghanistan and Sudan.
Yeah.
But a lot of people like didn't take them because they would give you terrible nightmares. Like, what is the? I can't remember.
I took them when I went to Africa, but
Yeah.
I never saw a mosquito. It was amazing. I mean, I took
Must
all,
be
you know,
what-
I had
must
these
have
air
worked.
for like a month.
Really? You never saw it?
Swear to God,
Wow.
we were out in the, I never saw a mosquito or anything. It
dry.
was, and I thought, what the hell did I take this for? I didn't see anything, but yeah, we took,
Just in case.
you know,
You
just.
pretty much have to, I mean.
Yeah, I think you take I forget, it was a pill or two, you know, for 4 weeks or something, and then.
Yeah, some chloroquine derivative usually, there's several of them. But yeah, so if you're traveling anywhere to Africa or Southeast Asia, usually it's recommended.
Yeah,
Left
they
one,
did.
maybe that was it.
Yeah. And again, it depends on what part of the world you're going to, because some are resistant to the older hydroxychloroquine derivatives, and it gets fairly complicated. What's the best preventative and treated medication? I was unaware of the nightmare side effect, though. I had not heard that.
Oh, yeah, it was a real thing.
But I mean, I probably only prescribed it 10 times, you know, prevention. It's not something you do very often.
Yeah. We were on it for like years at a time.
Yeah, that would be kind of a bummer.
Well, that definitely it kind of brings into light the code enforcement also tying into health.
Well, and the whole thing there too, I forgot to say, on my next report, there was one case of malaria locally at this point in time. Now, traveler, presumed, someone who'd been in Mexico and come up, not a local spread.
Wow.
So it is out there.
The world's getting closer. Remember, it used to take a long time for everything to get here, but it's just.
So clean up the tires in your yard.
Yes.
That used to be something that we told people all the time, just to do that yard. Go walk around your yard and make sure that, you know, you're not holding water or whatever. Like I have this pool in the backyard that my daughter keeps going to inflate for the kids, and every time it rains, it has little buckets, and I'm flipping that big pool thing over, but you really do need to check your water and stuff because of just all the mosquitoes that, you know, comes in. And it's, and everything, they say, what Carla didn't you used to talk about the bottle caps and different, you know, anything that would just hold that, you know, the water, even your plants is outside if you get it drowned.
And if you remember as a kid, I mean, the spray programs that would come around with the truck, and foggers would spray the whole neighborhood, and I mean, there was some pretty intense stuff back in the day of what we would, my parents would make us come inside, but I mean, you know, I don't know how good that really did. You're back out there 10 minutes later, and it really.
Rolling in the grass.
And now I read too that they're actually experimenting with taking, you know, of course it's the female mosquito who bites us, so It's only the female mosquito who spreads any of these diseases. So they're experimenting with taking batches of male mosquitoes and sterilizing them, putting them out into the wild then, who then try to fertilize the female eggs. Eggs are laid, but they don't hatch because it never comes out. So it's competition with the males who can fertilize just to reduce populations, and a lot of interesting things going on to try to combat the mosquito population, but.
Trying to visualize how you sterilize it.
I know.
Get them all in a room and radiate them, basically, is what
Yeah.
they do. Yeah.
Well,
Without killing them.
we used to have a guy
Yeah,
that
just enough.
separated them. We used to have a sanitarian that would be in his office. We catch mosquitoes. We had a mosquito program. And so we would catch them, trap them, and then he would be at his desk separating the men from the women, right? Yeah.
Men from the women.
Man, talk
Yeah.
about tedious.
I
Yeah.
guess.
Yeah, you couldn't breathe hard because then they just blow everywhere.
Yeah.
Just go everywhere.
I'm just laughing.
Then you start all over again. Like
The county
West.
mosquitoes, because we had to send them to the state, that's how they found out if West Nile was.
Oh my.
Yeah, that was.
Well, and some health departments still do the
They
mosquito
do, yeah.
pools, right?
Yeah.
Mosquito pools.
The wealthy ones. Didn't have enough money.
Yeah, we're just trying to get the tires moved.
Yeah.
Well, thank you, Dr. Jen. Appreciate it.
I figured everyone would love to. I was gonna share some pictures of the bot flies, but I thought, no, those are pretty gross.
They're mental photos in my head right now
Yes,
based
they were
on your
pretty bad.
description. That brings us to old business. Fab, Jackie, you have anything there?
Fact, yes, just an update. Here is the first go-around of the chalk. So, and we're all going through it and making sure that it's accurate, we can read it, the graphs are on the right page, so we are in this process. I know, it's ugly, so we will not give this, yet, we're all working on this. Know that once we get it down and everybody checks for mistakes and all the accuracy is done, then we'll get a schedule that we start educating the community, right? And so we'll talk to county commissioners, all of our boards, city council, you get out to the public, FCFC council, and so you start, going out to say, to tell your community what the findings are. Anytime you do surveys, you're always supposed to report back out of what you found. So anytime and then especially when you use your community partners in surveying and having them all a part of this assessment, then you report out what we found as you begin to start doing your community health improvement plan. And so, just letting you know that this has kind of been completed, and we're just kind of, Carrie said she found a whole lot of mistakes, and so, to be continued, but you guys will get this when we're done, everybody get one of these. What happens after we talk to everybody, they're placed on all 3 health departments' websites. So it's public information that a lot of people go to, because there's a lot of good information here. So that's probably the update with FAB.
Okay.
Mhm.
Is there a Cliff Notes version of that?
It's pretty much what you think. I think that we're gonna probably still be in line with the states. It's mental illness, so mental illness is suicide and everything underneath that, drug addiction, all that is a mental illness. Chronic disease is always obesity, smoking like the lung cancer, and hepatitis C, those kind of things, chronic illness, and then it's infant mortality still, as far as on that side of babies, maternal child and health care. So we'll probably land on that. Access to health is pretty much open. We have a lot of access to health. The problem is we do not have providers and doctors. So it's a long time to get into dentists. It's a long time to get into like a lot of our specialty care. And so we have a lot of hospitals, but it's just it's long waiting lines still, so. To be continued. Almost everybody has kind of insurance, but everybody's booked, so.
No docs.
No docs, no nurses, no teachers, but, yeah, so anyway, so to be continued. It's supposed to be turning around though, but yeah, still, that's Cliff Notes, pretty much.
Nice.
Mhm.
I'll be sure to read the entirety of that.
I know, right?
Tobacco 21?
And I'm gonna have Carla help me with this, Tobacco 21, when I say help me with this, our ordinance, everything is still on schedule. We're starting to, license in January. However, I am still going to press forward and tried to get capping. Oxford is an article in the, packet. Oxford went forward and they're capping the number as well as they're doing the, not close to parks and schools and et cetera. They're pretty, being restrictive with that. And when we had a call, I was in New York, Mayor Nicola helped me with this. We had a call where it was the mayors of Oxford, Hamilton, and Mayor Nicole was on the call, and there was the health, all three health departments, and there was a Visions, remember that one?
Yeah.
And we were talking about how important it was to make sure we get some of these restrictions in. But if Middletown does not do anything like capping, then we're just gonna lend to all the VIP stores and everything to come to Middletown. Because if Hamilton is doing it, and Fairfield is gonna do it, and Oxford's gonna do it, then it's, and I think, stop me and correct me if I'm wrong, we just got another application for another tobacco VIP shop. And so we'll just keep getting them, and so if we don't cap our number. In the article, I read it too long ago, I think they said that Oxford was capping theirs to, I mean, they have a small amount. Oxford currently has 27 businesses, including 8 specialty shops and 6 gas stations, and they wanna cap theirs to, was it Carla, 15? I mean, they want, yeah, so, to be continued, that's why I think it's important. It's my understanding when I had spoken to the councilman that had some concerns that they are not opposed to capping. So in this packet as well, we have information regarding how to go through the process of the zoning piece. I spoken to Deborah in zoning upstairs, and she said as a process, she put it in the packet, and we'll go through this process to get started if you guys so choose to. She said it may take a total, it's a long process. She said it may take a total of 3 to 6 months. It doesn't really matter as long as we can cap at whatever we end up at the time.
That's not for us to do, right?
It's for zoning. I think you have to start, she said that she can't, and stop me, Carla, she said that in order to even start the process, it has to come from the city manager or the city council to start putting the, notice in the paper and starting the whole process. Then it goes to the zoning board, and then you have to have 30 days for this and 30 days for that. So it may be like 3 months if everything works out.
It needs public hearing, I'm sure,
Yeah,
from
right.
planning commission.
Right.
Which is 2 hearings and 30 days to enactment.
And so, yeah, this is the extra stuff that we hung out. I think we should still do it, because even if it was April when it is done, we can cap it wherever we are in April. But just to not do it, I think we would be setting ourselves up for future.
Hamilton doesn't have a cap though, right?
No, I don't think
That's a
Hamilton.
zoning, though.
Just the zoning
So
restrictions.
the
just-
number may be higher than 69?
Right, if we don't do anything, I think it will. But right now, where are we, Carla, with the new one coming? 70. We're at 70.
So they can still come in now before you do.
Mhm. And the more popular they get, and if they're restricted in certain places, I think it would just be. So anyway, I will still see go through the process to do it. And then if they vote it down, then it's fine, but I think we should try, especially since they, said they don't have a problem with capping, the person that was concerned about it, with capping the number, just like they're gonna do, the marijuana sales, whatever, so. To be continued, if you guys are in favor of that, just going on and make sure, we discussed it on the phone, I think, you'll find your city that'll be really, attract those type of businesses. Again, this would not affect large, when people, well, we want businesses in town, it
We're
doesn't affect.
unfriendly
those
to
large
business, so you don't wanna.
So, to be continued, but if you guys are okay with that, I'll just kinda go down the zoning roll and see if we can go through I know. I'll take the bullets. I'm numb, I'm old and numb. So, yeah, I think it's worth trying to do it, and so. To be continued, but that's about it on tobacco 21. Anything else, Carla? We have Oxford's ordinance language that we're gonna share with zoning upstairs too. So we're gonna give them all the tools that we can to make it
Okay.
pretty much easier, and we'll just meet with the, what is it, zoning commission? Planning commission,
Yeah.
okay.
Planning
And is that James over that piece? Is it?
Yeah.
Okay, that's what I thought. But that's it for tobacco.
We met with, Megan, did you wanna interact? with
Oh,
her?
yeah, and Interact for Health, we requested funding from them, so we had our site visit where Carla and I met with her. And we asked for 3 years of funding, and she said she'll take that under consideration, but most people get 2 years of funding. And it looks like what we asked for would be decided. She said someone was out of town that actually does the stamp of approval, but, and I think we requested 39,000 every year.
Yes.
And that helps with all the things that we're doing, like the mailing, the time, the inspectors, if we have to do anything to help with the people that go out and do the, sites, as well as if we start any programming in schools, whatever we need to start. The thought with Interact for Health is to give health departments startup money, so that when the licensing revenue comes in, it kind of offsets the cost of what we're doing, so. And so,
We're doing
yeah.
200 a year,
250.
250? Okay,
Yeah.
not really anywhere near the cost of
Yeah, the license, 250.
17,500.
But then remember, Hamilton said they're finding people, they're paying the fines real easy, they don't mind the fines, but the fines keep going up. So the people that are not being obedient to the rules or whatever, she said, they haven't had a problem with them paying. So it's not painful yet, but I guess each time they get fined, the fine increases, just like ours plan to do, so that will help with some of the licensing for those that do not follow the rules, but, yep, I think that's it.
Okay.
Carla, you have anything else for tobacco? Good.
Right, Board of Health vacant position, I don't think it's vacant anymore.
It is not vacant anymore, we put it in your
Was
package.
she told that she's
Um,
on the Board of Health?
well, Amy said, we didn't get the letter yet, but Amy said that she was sending the letter. Yes, and so I'm hoping as we speak,
And this was a
when,
week ago, we could have had her at this meeting.
yeah, and Amanda spoke with her, she hadn't heard anything.
Emily
She was-
hadn't heard anything.
Hadn't heard anything
come
yet.
Last Thursday, Emily hadn't heard anything. She said she was hoping to hear, and then I think it was Friday, Amy said that she had been appointed, but they hadn't given her the appointment letter yet, so that's why she couldn't be here, but they had decided that she just didn't receive the appointment letter yet.
So I am gonna move forward, and make sure she is oriented, and then she will be all set.
I've had people appointed one night and at the meeting the
The
next
next
day
day?
on the
Yeah.
regular, yes. This is simply a failure to, not on
Let
your
her know.
behalf,
Yeah,
but
to let her know.
yes, I'm sorry, she should have been here.
Well, and this is.
Not her fault.
Right, August, so she will.
It's just like there's another month now
Mhm.
where she could have been here, and she's clearly very qualified.
Yeah. And she'll have to put her application in
Community member.
again unless we decide, because
Right.
she's filling the term of Dr.
Right.
Patchett, that's over in December, so she'll come on in September, October, November, December, so, I mean, we'll put that, I'll tell her that we can keep the application in for you guys, cause you guys would have to just turn around and reappoint her. But, she is at Atrium's infectious disease, and I can't tell you how important this position is, because they always give us that heads up if what they're saying in the hospital, in the emergency room or whatever, is really a good
Yeah.
position to have.
Yeah.
Work really closely, so we're excited about that. So I'll make sure she's all ready to roll by September's meeting.
Thank you.
So that's it with that one.
Okay, new business. No travel authorizations.
Yes and
So
no.
No malaria, hopefully.
So it's no travel authorizations because ODH has not come out with our fall conference schedule yet, but it is scheduled for the, we have a board meeting right before, so I said I would wait and make sure you guys get it. So it is September 13th, 14th, and 15th.
Oh, so the day after our next meeting.
Yes, so the 12th, we'll get all the information, and I can get it out to you before then, but they have everything up, but just no schedule yet of the conference. Everybody complains about it because they always have to have it approved by the boards, but ours just barely makes it, so. And I didn't want to, guess on you know, the charges of the conference or whatever, I wanted to get the hard number, so we will have that next time, but as far as now, we do not have travel authorization, that's just a heads up.
Okay. So we've got this ordinance, first reading of ordinance number 2023-01 by title only. Do we have a motion to read ordinance number 2023-01 and 2023-02 by title only instead of? All in favor? All opposed? Okay, I think we did that okay. So, then we'll have a first reading today of ordinance 2023-01, which is an ordinance amending fees for the licensing of food service operations, mobile food service operators, temporary food service operations, vending machine locations, retail food establishments, mobile retail food establishments, and temporary retail food establishments. So our first motion allowed, so I didn't have to read this whole thing, I guess, into the record, which is lovely. Did anybody see or have any questions about that first ordinance? I assume at the next meeting we'll vote on it. Is that how that works? Or we do a first reading only?
First reading.
First and second at next meeting, then it's third and adopted.
So we don't vote till the next meeting, right? Okay, just clarifying. Okay.
Mhm.
Still no vote at the next meeting.
Oh, we have a third
meeting.
okay, that's right. 3 readings at the Board of Health. Okay. Well, we got lots of time to look this one over, think it through. Carla, did you have any comments on
No,
it?
just as a reminder, only the fee changes, just to note again, is B and, D. Everything else is the same as previous year.
Okay. Hearing no questions, we'll, do the first reading for ordinance number 2023-02, an ordinance amending the license fees for recreational vehicle parks, recreational camps, combined and temporary park camps. Any questions on that one? Okay. First reading's complete, unless you have anything further.
And I just wanted to mention, the only fee that I had proposed, we pulled that Jackie wanted me to do some more, get some more information, was the water fee for the water samples, right?
Mhm.
And so, we were looking at what other jurisdictions were doing, so it appears that they're doing something similar, charging, a fee and then charging, charging the base fee, and then charging, the fee for the sample. And that varies from year to year. We looked at it and it's about $400 or $500, so that the owner would have to pay. But anyway, we're gonna wait on that and still check with other jurisdictions, but it seems that it's similar. Everybody's doing something similar. And that was the water sample for the off-lot discharges systems that require a permit for sampling. That's it.
Okay, well, that brings us to open discussion topics. Do any board members have any topics? I'm gonna refrain from anything today, so it's all to you.
You are going to.
Yeah, I don't have a topic today to stir the pot.
Well, are we gonna get to the senior?
Ah, yeah,
Center.
yes.
Good topic.
Good topic.
Yeah, you throw that one in the pot. I like it.
Yeah, it's very concerning. The meeting was a little confusing, cause they went into executive session. Okay, we're buying the building, and then nobody knew anything else, numbers, anything, so I'm not sure where we stand with all that, but.
Yeah, that's it.
I was gonna say, I think the mayor probably could give her
There.
side of it, or her.
So what I don't still fully understand is why any of the numbers are secretive, because I feel like we all paid $7 million and should know. So I guess I hesitate because I don't wanna get into a legal situation, but I still don't, it's not clear to me why we can't open the floodgates on numbers. It's millions.
Do they know what the
No,
numbers are?
They don't entirely know.
Maybe that's why they.
I know it's multiple millions of dollars
Yeah.
at a minimum.
Yeah,
I can say
it's
that.
mind-boggling, to be honest, when you just start getting
So-
into it, it's.
It looks like that there's a single signatory on the reverse loans, or whatever you wanna call them, mortgages taken out on the building, before the levy was even done. And only one person signed apparently at the bank for it, and
Well, that was my next question. I mean, this might not be something that we have to talk about here, but she couldn't go in and just take a mortgage out on a building she doesn't own, so who owns that building? Like, how were they able to do that?
Right, so it's the nonprofit, but they have a board of directors, and the
So,
board of directors
just
has
one
been
person
fairly
on the-
absent, and so
That's
they, I guess their charter, I haven't read it, but so I hear the charter allowed for a single signature.
You know what, and I heard, that you can have policies, like in-house policies, like, I can just speak from what I know of our church. We have a policy that you have to have 3 signatures.
Right.
But on the flip side, the bank doesn't require 3 signatures. You can cash a check at the bank. So I think when you set up your account, you might need the pastor and the treasurer and the officer to come in and secure everything, but moving forward,
Yeah,
you
can
don't
have
need, yeah,
one person who's
Yeah.
designated to do stuff like that.
yeah, so
for
you
an
can,
organization.
yeah, so you can have in-house policies, right?
I
But-
can't figure the whole thing, supposedly they wrote that it was making money. It was profitable. He said 3 years ago or 2 years ago, and then, I mean,
I'm
where
not
did,
sure
where
if they're
did, where
profitable,
did they
I
lose,
didn't hear that.
well,
Well, cause
where did they lose all this money, millions? I mean,
Well, they spent $1 million on the renovations, well,
$1.5 million,
900 some
it says.
thousand,
Mhm.
so there's that.
well, moving forward, what are we doing as a community to help these seniors? Because, I mean, obviously they said we're buying the building, but that doesn't have anything to do with the day-to-day operations. So we're
There's-
still in the same predicament that we
Right.
were in. And so who's in charge of taking all this income and foreseeing that
So-
moving forward?
Just to be clear, the public is about as confused as the rest of
Everybody
this
else.
building. So
Okay.
this is not this is not cut and dry. There's also all the computers and everything from the whole
Mhm.
place are with the police department.
Okay.
So no one can get a lot of the answers. Just, if you're confused, you're not alone.
Okay.
And I think when they were saying Jackie was over the operations, I was like, okay, cause I don't sleep well anyway, and then now I really haven't slept
don't have to go
for
to
7 days now. But no, I think what is, the intent, can I put it that way?
Mhm.
The intent is to rectify the problem and see if this organization can be sustainable. So that's the big goal. How it happens between legal stuff is all in the city manager's area with the attorneys. What I'm trying to do right now is find a way to figure out what's going on in the building, what needs to go on in the building, and how we can make that happen in the building on a dime. Because there's no money, right?
It's not real, it's
So
not
I'm
really
trying-
a city thing though, is it?
Well, that's
No,
what-
it's not, and it's
that's
not
where
a
I'm
city.
The city,
thinking what
asking
the
the
city
city to
should-
pay all this money to
Money,
buy it, but
exactly.
it's not a city
It's not a,
entity.
see, and it's not, but I think the problem is, and Nicole, correct me, is it came to the city as, we're gonna close unless you
or
can
help
intervene.
us out.
And so I think the city had, what, 2 seconds to think about what
Yeah,
that is?
Yeah, it
So
was
it was
either you
just-
do it or we're
Yeah,
closing.
right.
If the city takes all that money to straighten it out, the city has no money for anything else.
But
well,
you're not
that's-
wrong. Here's the crux of it, right? The citizens paid $7 million into the building. So do we let it go? Or do we try to recoup some and try to buy it back at $1 million and something? I'm not saying I have the answer to that, but the decision the other night was looking at the numbers and also let's look at the zoning of that building. If it goes, what could it be?
Mhm.
Drug rehab, very quickly, overnight, no
The
zoning.
big-
Now, that's
biggest
always the
vape shop
threat.
ever.
It could be, someone could buy it and turn it into a lot of different things that we don't want there. But then again, free market, sometimes just let it happen.
It's a whole lot of
It's
questions.
not an easy decision. I still don't know which is the right way to go. The other problem is they weren't paying payroll tax to
No.
anyone, to include
no.
the IRS.
Really?
Oh, they were paying people
So-
with cash and gift cards. It's the most bizarre
Oh,
thing.
really?
For
I didn't
months
know-
and
no
months
kidding.
and months.
So
Oh,
my
wow.
concern is if we do buy it and the IRS
it's
comes
just-
knocking,
it's
they always
bizarre.
get what they get their money. So I don't know. There's just a lot. The lawyers have,
Yeah, it's just a lot. I mean,
So-
thank God I don't have to worry about that part.
Can they
So there-
get
yeah, there's
out
two
of the whole
issues.
restaurant business and just let somebody else run a
Right,
restaurant
that was
out of
a-
there. Like Mark runs his cafeteria out of there. Why do the city have to be involved in the restaurant business?
See, I think all of those are questions and answers that could happen, but I think you gotta sever the relationships with everything too.
Okay,
And
right.
we're government, right? They're nonprofit, two different rules and regulations, and so all of that is kinda sticky to make sure. If any money's coming in now, who gets the money? They may not be able to keep the money because their banks may be closed. We don't want the money because
It's a
just a whole
cash-only
lot of, it's a
operation
whole
right
lot of
now.
gray areas that, yeah.
Cause no one can accept credit cards, cause there's no bank accounts tied to them.
So they're just operating with just straight cash
Yes.
right now?
And so you see what I mean? And so you may not want your hands, the city may not want your hands in that confusion. I mean, it's just really and truly what you can say that's honest to the community.
Well, we were
Is-
operating, I mean, they've always operated, you know, with volunteers and everything, and I think there's a lot of seniors that would step
Mhm.
up.
Mhm.
Sure.
They'll do whatever, you know, they need to do to help each other.
And that's where Jackie's
And
coming into
that-
play.
Yeah,
I
what are
think
you
that's-
doing?
Well, I'm moving the shelves around. So you know what, in my mind, you know, if you wanna have a perfect solution, in my mind, it would be a meeting. Remember all the people that were downstairs in the
Uh-huh.
council chamber? It would be a meeting like that to let the people talk and vent.
Okay.
Because I think people need to talk and vent and be heard, right? So
Mhm.
we would have that, and then you just let people do it, right? And then it would be 2 meetings, this is in my mind, 2 meetings with our community partners. We have community partners with our Ohio, IS grant. We had hospitals, both hospitals represented, we had YMCA, we had every community partner pretty much at the table. And then we would invite others, and the 2 things they have to bring is either money or expertise that they can lend to this organization. And we could maybe try to, if we have the opportunity, to make it run until we find that solid, person to take over the, you know, whatever.
Mhm.
Because like you said, people will volunteer. So say for instance, they have activities. Can we get the people that do activities, like say we have chair volleyball, and can the YMCA provide that? And then it's free, so we're not paying those, cause some people, activity people were getting paid. I think, they were getting paid for their activities. If they have a bridge game in there, let it be open for bridge, that's free. If they have pool, billiards, let that be open or whatever. So you're just paying maybe staff to open and close it, maintenance, I mean, keeping a bare minimum, keeping all the activities pretty much going if you can, and making sure they're fed, those and we probably can't get into even council on aging because it's requirements of how it's ran and stuff. And so you're just trying to get in there and get a resemblance of normal until you find out what all the nuts and bolts are. That's what I would be trying to do. And I think a lot of people have reached out and said, we'll help, we'll help, we'll help. Some people are saying we'll help free, some people will help with minimal cost, but we can't do anything in the building until we decide whose building is it, with, like, you know, and so we're putting that kind of stuff together. I plan on going to other senior citizens to see how they operate. So far, most of them do not operate alone. They can't afford to, so they're usually with another agency or with other partners. And so that's some of the things that we're trying to investigate and do, and it's pretty, I mean, we can build utopia. I mean, we can build something and then we have to just see if it runs and works, but we can't do anything. But we're ready to, you know, pull the lever whenever we find out all the legal stuff. And I don't know if that legal stuff happens in a week, in 6 weeks, 3 months, 4 months. You know what I mean? I don't know when all of that stuff happens. And this is another thing too, we have to be reminded, or if it can happen. It might be something that we just can't, we just have to let it crash and burn, and then we have to get it back, and then maybe let somebody, you know, take over that has good intentions or whatever. I have no clue what, but, trying to look for ways that if the seniors did wanna go into the YMCA's, they can go in free without membership, they can go and meet in there. If the building does close down and lock, but right now the building's open. And right now the board of directors are still I mean, they're still present, you know what I mean, so. So
Yeah.
it's clear as mud.
Yeah, I mean, there's 2 issues. One is the building and
Mhm.
2 is the programming.
Right.
So we've
Right.
tried to make decisions that are in those 2 buckets, because the programming in theory could happen anywhere. Cause, I mean, if the bank took the building tomorrow, the bank takes the building tomorrow. Like, I don't think there's a whole lot we can do
Right.
about that, and that could just happen.
Yeah.
So,
Yeah, and then what monies, cities, what monies can be used, sometimes, they have to figure out
Well, it's quite
legitimately.
interesting, I'm not that political with Middletown's politics or going to the city council meetings, but I've now unfortunately been at one. And I see this other one, and, they come up with all these, they pontificate and they tell you all this stuff, oh, we're gonna make sure the building's gonna run, and we're talking about buying the building and all that. Well, from what I just heard from you in 10 minutes, that's a bunch of baloney. They don't know what the hell is gonna happen here. They don't know. Oh, we can't let them not eat and all this stuff. Well, it sounds great, and it's
Does sound
certainly
great, doesn't it?
what
Yeah.
you wanna do, but they have no control over that, it sounds like to me.
Yeah, well, we
Just
don't
a
know
bunch
what
of-
we have control over.
You
Well,
really
they don't even know, but I
Don't
mean,
know.
they're just, we'll.
Gonna try was the,
Mhm.
when you talk about funding for the building, the thought is to use ARPA dollars, which are the American Rescue Plan Act dollars that expire at the end of next year. And for that purchase, the result of that would be that we have to bond out the difference of the fire stations, which is so we go into debt. We're already gonna go into debt on the fire stations, cause we don't have a choice, really. There's choices, but there's not really on this one. And so we would just have the fire stations would be in a little more debt than they would otherwise. That's really what the proposed plan is financially. If I were to be very,
That's a great plan.
I know.
And like you said, it wasn't the responsibility of the city, but it's kind of what you get. And the good side, I always have a silver lining. When you bring all those community partners together, that's a story in itself. People do want to help, and they do want to make things happen and continue for all vulnerable populations, right? And Middletown really is good at coming together for those purposes. And so I think we could probably come up with a plan. We just need the other details worked out. But I think we could come up with a plan easy enough to do it. I remember we used to do exercises. I was on the board, Ability's first board, and they used to do exercises there. And the instructor came in free, but she had a basket at the door. And she received more than $25 from the people that came in and did the exercise, because everybody put their money in the basket or whatever. So she did it free, but it was by donation. And so you can do things like that maybe can trim some of the costs. Now, they're not gonna be those big costs that we're talking about, but that's for the services that people are accustomed to, like I said. So we can see, but we wanted to make sure that whatever we did was correct. We wanted to make sure that people that needed certification had certification, had background checks if they're dealing. FYI, I have to look at this too, but usually elderly people are protected. We're a protected population. I keep talking like I'm not talking about myself. We're a protected population, just like kids are, right? Because we can be taken advantage of. And so you wanna make sure you don't have people that's around them. Because, seniors, they get used to people and they start talking to them. Next thing you know, they'll sign over their house to a nice person that's giving them exercise. You have to watch that too. So we wanna make sure if we're doing anything, we're doing it correctly. So you have to work really closely with elderly services, council on aging, et cetera, because that is another area. I am very aware of my capabilities and my restrictions, and so I always would call people in that would know what to do. And another good thing, Paul has given me some staff to help with any of the clerical part or whatever, and as well as I would use really and truly all those community partners that have all of those skills and expertise to research some of the things. So it wouldn't be like Carla, Amanda, and I are over there opening and closing the door and doing that kind of stuff. It really would be about some of the research behind the scenes and utilizing people, so.
Well, was to try to generate some income, that if they're not checking the people that come inside the building, they're leaving money on the table, because you only get paid per visit. So if they're not checking in, they're not getting any money. So
Right.
there's never been, from the first time I walked in the building, I thought something's not right here. They have no idea who's even in the building, who's paid, who's not. So if Silver Sneakers, if their insurance company is gonna pay, that's something that could start tomorrow, as far as who's
Just
coming in.
document it.
Because, we don't have that many Silver Sneakers at our place, and we probably bring in 700 a month. Well, if you have 2,000 over there, at a minimum of $20 a person, cause if they're paying every time they come in the building, that's,
So
somebody needs.
insurance pays, is that right?
Mhm.
Ah, I didn't
So
know.
we have, there's 3, it went from Silver Sneakers and it's like Active and Fit, I mean, there's multiple insurance companies that have kinda jumped on the bandwagon. So there's 3 different insurance companies we bill every month, depending on
Okay.
what services, so, but they
Yeah.
have to swipe in, and then every month we generate the report, send it to them, because if there's one thing that's off, they'll kick it back, so they could have came in all month, and if they weren't really, like if they're changed insurances or something, then, I mean, obviously we've lost out on the month, but they have to, it's generated every month we bill the insurance
Mhm.
companies.
It's a revenue for you.
Right,
Yeah.
so that would be something that could start now.
Right.
Yeah,
And there's, obviously, they haven't been doing that, because if they don't come in and they're signing in, but I guarantee you they're not signing in, because I have instructors at my place that teach over there, and when people come to class, they're not signing in.
So the one issue with that is there's no entity to collect the insurance money right now.
Well, then that's,
Which is the
so
problem.
it doesn't really matter.
But you're.
But in a month, I
That
mean,
is-
if they're
right.
swiping in now, by next month, maybe it will be.
Right.
Well, it's
right,
obviously
and you come
poorly
back,
run.
you come back,
Yeah,
submit
so,
claims for,
Yeah,
Right.
yeah,
it
30
is.
days.
Right.
I'm just saying that's something that could be, that,
It's a good idea.
right now, like,
Or should have been happening.
correct.
Because I do, also just, I would warn anyone, if you think, oh, let me help donate to the senior center, it will go straight to debt, like, there's no helping the seniors if you donate to that group right now, so just as a, like, they're so far
Okay.
under that, don't think you're gonna donate to that nonprofit and make really, unless you have millions, you're not gonna make enough difference, cause it's gonna go straight to paying the bills that they're behind on. And they're probably, if I were to guess, they'll file bankruptcy in no time, and so that will dissolve itself. Just, that's what probably is gonna happen, and then there'll have to be a new entity. I'm not saying for sure, but that's what I would anticipate happens, so,
Well,
yeah.
Yeah.
It's
So
a mess.
we'll keep you updated
Yeah.
on that, but I always keep going back for the clear goal. What's the goal? What's the goal? So the goal would be if everything was nice and clean and tidy, we would do exactly that. We would get programs started.
Mhm.
We would get volunteers at first. We would try to keep our overhead low. We would make sure the billing resources are up. We would, all of those kind of things that you get
Right.
started, cause you do leave a lot of money on the table not doing that.
yeah,
But that usually, you guys, I'm gonna tell you, is the first thing that goes. When you're losing management and when you're doing certain things, the first things that goes is the things that make your money, because, you lose staff. It's my understanding the staff are very, very, very new.
mhm.
So most of the staff is filed unemployment, and the goal maybe would be to bring them back under a new operating entity, actually doing real work, but right now they're on unemployment.
Okay, we'll see. I just wanna make sure they keep their programs going. That's all.
Mhm.
So,
Yeah.
but I know my instructors would help anyway.
Mhm. See, that's what we were saying. I think community partners all think about it. When you're over there, you're not like paying rent with those classes. So you're doing it out of the kindness of your heart, and you
And
like
they-
what you're
they
doing and what,
love
yeah.
being there, yeah.
Mhm. They love being there, and so I think we could, we could
Mhm.
float it for a while once we get some structure, so, yeah.
I wanna also recognize that because Jackie is helping with that, the rest of the health department is, there's a give and take
Oh,
on
yeah.
Jackie's time, right? So,
Mhm,
thank
mhm.
you guys for, I don't know if you have yet, but preemptively, I'm sure you're gonna have a little bit more on your plates, cause
Mhm.
Jackie's gonna be over helping with that as much as makes sense, so. Thank you guys.
Succession planning is important, isn't it? 'Cause I know you're trying. You got it. No, that's good.
Well, that was a light topic to bring up.
Sorry.
That was a good one. We had to talk about it for sure. Any other topics anybody have? Okay, well, that brings us to reports. Jackie,
And just to piggyback on that, it's important that we do this. This is a targeted population, and it's a big part of our population, and it's what public health always talks about, you know, how you wanna make sure you protect them. And so, again, that's good group. And it goes into the syringe exchange, reminding everybody that, I think September 1st is a Friday, and syringe exchange meets on Fridays, and that will be the last date that they would meet. We're getting a letter that goes out to all the health entities in Middletown, treatment centers, et cetera, that it will not be here. Plus, we have locations of surrounding syringe exchanges that you can give out to clients or let people know until further notice. I'm laughing because I think I have the
There's
tail.
a tail.
Yeah, I was like, look at this. And so anyway, and the gathering, people that come to the engagement center, the gathering, last day will be like September 2nd. So both of them are happening at the same time. Met with Kevin Harlan with Atrium, and he said, well, what does that look like? What should I tell my emergency room doctor? And I said, well, expect increases in, you know, infections, overdose, endocarditis, you know, spinal infections, et cetera, everything that kind of leads to IV drug use type things. Hep C may increase, all of that. Now, if it doesn't, that's just, you know, hallelujah, but those are the things that harm reduction really does kind of protect, and so we will see. Butler County is trying to, I think they got approved from ODH to get a mobile unit, and that mobile unit would be almost like Hamilton County's a long time ago, where they can come up on the unit. So it would be a 24-hour, not 24-hour, but a 12-month kind of program where you don't have to be out in the elements. You can bring people up on it and exchange. And then they would start looking for other locations, maybe to take that mobile unit, because it has to leave Access Counseling's parking lot, because they said they wanted it removed from there. So if we look at other locations like churches or that kind of thing, I don't think anybody really is, I don't think our council or our city manager has the appetite of trying to look for other locations. What we would hope is Hamilton City would find some locations.
But like doing it at a soup kitchen or something like that is a good idea. I know they have Serve City in Hamilton.
See, and
So
they really.
They need to do a partnership like that.
Right, yeah, and they really just feel like they didn't want any in city limits of Hamilton, like close to downtown, which all of those are close to downtown. It was a treatment person at the meeting that has, you wouldn't know her, Ruth. She has a location that's on Sims Road, and it's like a national, like Treatment Centers of America, it seems like. But anyway, it's like, you know, so it's on Sims Road, so it's right abuts next to Fairfield. But that might be a good location, because she said we have a big parking lot, and that might be a good location. So they're still looking for other options. But we need to bring to city manager and city council, is it okay still to do harm reduction stuff without the syringes? I'm assuming no, but we'll see, because harm reduction stuff like giving out Narcan and doing HIV, testing and stuff like that, still would bring that crowd, and so finding a location, I don't know what is it the syringes itself, or is it the people that you provide for it that you might be attracting? I have to figure that out, but we're still working on that. But again, it goes back to that population. When we have COVID, when we have Hep B outbreaks, Hep C, HIV outbreaks, you like to know where they gather and where you can get to that population. Very important in times of emergencies and communicable disease type activity. So to be continued with that. Last but not least, we're trying to look at Spanish Latino resources. We have a large growing Latino population. We struggle in here when they come in with no one with them, when they wanna open up restaurants, food trucks or whatever. So I think the city manager has been meeting with some people, and I know it's supposed to be a Spanish Heritage Festival coming up. So we're trying to tap into that a little more too, because it is something we need to do. I mean, we took them upstairs to small business was closed. It's a kind of, I feel incompetent that when people wanna do business with the city and nobody can understand them. You have to say, well, come back when, you know, talk louder and come in, you know, so we need to, yeah, it's just not appropriate. So, to be continued, a couple of us wouldn't mind taking Spanish in our
I was
free
gonna
time. That was
say.
before the Central Connection thing, but we said that, we would take it. We said, but, it takes a while to get.
Spanish lessons for seniors,
Yeah.
That's what I'm
everyone's
saying.
winning.
Yeah, there you go. Yeah, yeah, falling and can't get up was the first thing that we learned. But anyway, to be continued, but realize too that we do have a large growing Latino population, and it would benefit us to really tap into all the resources so that we can make sure they're utilized as, you know, as best can in our community. But I think that's it. I gave you this was a neat little sheet that they had, cause they had a spike in overdoses. All the overdoses, these were fatalities, were in Hamilton. So they weren't Middletown, but they're getting messages out that fentanyl is in everything. They made the mention that if you could find heroin, that would be a good thing, but everything right now is fentanyl and meth and xylazine. So, it's just,
And this is the city that doesn't want a syringe exchange?
that's correct. And they know it too. I mean, the Butler County commissioners know it, and, Pat Mueller knows it. I mean, they know it, but it's just. And then this is, I'm excited to tell you guys, please, please, please try to get this on your calendar. I will email this out as well. August 31st, just 9 to 10, only holding you 9 to 10. But this is gonna be the summary of Phase 1 Ohio Is information. So from start to finish, you'll hear about the grant that we were partnering with Safety Council in, which was about social determinants of health and member index zones and what census tracts fared worse health-wise, mental health-wise, physical health-wise. So what we are doing, and it's really, it's gonna be, you know, only 9 to 10, you can tell it's gonna be a really quick turnaround. They'll feed you breakfast before you come to work and just find out where the grant was, what we started with. The ambassadors hopefully will be there. The health improvement partners are all invited to be there. What we were doing, what some big wins are. They started a community garden over in Sherman Park area. They cleaned up 8th Avenue and Yankee Road corner parking lot, and Burns has volunteered to help us put flowers in there and beautify that corner. It's just a whole lot of involvement with the community. In line with 17 Strong, in a sense, where we're just keep picking up community partners to help the city with all the different, what did you call it, nuisance, stuff. We can call in and help them find tall weeds and grass, help them find trash, help them find, so we have a lot of people. Last night's meeting, it was probably about 25 of them there, so it's a good turnout. They were at, National Night Out, they were in the parade. So the ambassadors are really starting to get involved and bringing more and more people on. Phase 1 is finishing up. We'll tell you about Phase 1. Phase 2 incorporates Amanda area and Wildwood area, so it moves out in the city, the rest of the city.
Do you have
So-
any Spanish-speaking ambassadors?
No, I know. Yeah, and we do have some Spanish-speaking people that helped us, and we're still working with Alex. But it really, really, truly needs to be massaged and.
I have a neighbor who's Puerto Rican, and in
Mhm.
that community,
Mhm.
very, lots of energy.
See, yeah, I want her name, yeah, get her name, cause we have, what we are hoping with the Heritage Festival, we would start finding them. That Heritage Festival should be cool, they wanna kinda have parades, so that you can see that, where they're all, from. And it's a lot of Colombian, Puerto Rican, Mexican, but then it's, I think it's Dominican, yeah, a lot of Dominican. And, some Peruvian. I mean, it's like it's pretty cool a bit when they, so Spanish is just the basic. Don't ever start saying hola, cause they start talking to you in Spanish, and that's just the biggest, so do not do. And then we said, they were like, they come to you and do it, so, anyway, to be continued, but most of this stuff is in there, but that's it, I think, I'm done, I have all this other stuff, yep. So that's it, I'll be reminded to get all that out electronically again to the board. And I wanted to double check with you, on the 14th, that's when George Lane and the homeless
They
thing
moved
is-
it.
Did they move, I was gonna double check with you. So do you know when,
Yeah,
or email it back to me and then I'll get it back out? Because
Yeah.
two people have wanted to know about that homeless, remember the
it's now on the 28th at 11:30.
28th? And it's still at the government service,
Butler, well, I think so.
the government service building, 11:30?
Yeah, I'll send you the
Okay.
invite too, but in case I
I'll see it.
forget. Okay. Dr. Jen.
Reportable illnesses, we have 20 chlamydia, 7 gonorrhea, 5 hepatitis C, 3 hepatitis B, 2 group A streptococcal, 2 syphilis, and 1 malaria case. And interesting, Butler County had 1 malaria as well. Again, both seem to be travel or immigration related. And that is all I have.
Okay, thank you. Chandra.
Not a whole lot going on, other than, following up on the communicable diseases, the traveler. It's time to start preparing for flu, vaccinations. Locally, they should start shipping in, to providers within the next month. So be on the lookout for getting your flu shot, whether it's through us or, your own private provider or pharmacy. COVID vaccines are, waiting for guidance and what the exact formulation's going to be and how often, and whether it's gonna be a yearly or, continue on the, 6-month-ish booster. But those are all still kind of in planning phase right now as well, but we are still offering the current booster twice a month, as we have been in the past. That's about it.
Thank you. Carla? We approved, a license, approved plans for Verity Lodge, Head Start will be going in there, so, yeah. Let's see, what's the other one? Rosa Parks also. So Verity Lodge approved their license, and then we're looking at, Rosa Parks. We had a new, drive-through, it's not new, but it's relicensed, Yankee Road and 8th or 9th Street. So, Thursday, I went out with Sarah to the taco restaurant, which did not allow her to do an inspection, so we found out why they would not allow us to do the inspection.
They ran away?
Yeah, or at least we
Well,
think.
there's a
That's
presentation.
the name, right?
Yeah.
That's the name of
That's
the
the
place, right?
Runaway Tacos.
Runaway Tacos.
Yeah.
Where is this located?
They
It's
ran
on
away, or that's the
Yankee,
name of the place?
That's the name of the
That's how.
place. On Yankee
Maybe
Road.
I mean, I'm on the edge of my seat here.
I know, there's a presentation.
I know, that's
So-
right.
Go ahead. So it's not really a presentation, but we do have some pictures, so we,
Okay.
so when we went in there,
Oh.
that's how it looked, that's the front of
Where
the
is this?
establishment.
It's the old
Yankee
Checkers
Road.
across from, La Esquinita on Yankee.
No, it's across from, you say what?
I thought
It's
like
the old
La
Checkers.
Esquinita or
Yeah.
Esquinita is
Near
right
NASCAR.
there, and then this is.
NASCAR's, it's
The
across from
NASCAR
NASCAR's,
Mhm.
yeah. So this is the front half of the establishment, they have you see a crib,
Sorry.
so,
I thought that was it.
yeah, it's a crib and play toys and things like that, in there.
Ice cream machine.
And the ice cream machine, cause they used to sell ice cream, but they're not selling anything
Oh,
in the
okay.
front, in this area, but still, so go to the second picture. So, they have a camper out back, and the
Oh.
camper was not,
Oh.
they had some plumbing issues, so they were taking showers. This is a tub, and you see the shower curtain, so they were taking showers in the
Wow.
back of the restaurant, back storage area. You can see, you can go point to the shower
Is that
head.
not allowed?
I know, right?
If you look, you can see the shower head, which they've come off the water heater and put a shower head, and that's the shower curtain, that's dirty water.
Intuitive, I
in the
mean,
tub.
or not intuitive,
Resourceful.
ingenuity.
And then, the
Yeah,
next
innovate,
picture,
yeah.
they built up a wall, and they have a bedroom in there.
I mean, this is
Living
a
there.
zoning issue more than anything, right?
Yeah, well,
Right.
you
They're
can't
not
live in
serving
your-
food.
Well, they were closed, they weren't selling, they had been closed, so,
But they would open up sometimes,
I mean, yeah, but he's claimed they have been closed. They put a bed in there, they said that was for the kid. I'm like, you built a bedroom in here.
Oh, that's a large kid.
So, so do we have another, they
Does
had
the
their,
kid drink rum?
and then,
Yeah.
Did you see rum in that picture?
Yeah.
There's Bacardi in the, on the, you see it?
Oh, it's a little bar
Yeah.
back there,
Yeah.
Well,
So-
you know, you gotta bring something with kids.
So then they had also moved their refrigerator in there.
Wow.
I mean, I can see why they denied access.
Yeah.
Yeah.
So, I talked to, the owner and I told him that was Thursday. I said, I'm asking you not to open, which he claimed they weren't open. I asked him not to open and to have everything out by Monday. And I also talked with Larry, with the building department, because they had built walls and a door and everything up also. So we went back yesterday and everything was gone. So that's how it looked.
Okay.
Okay.
So that was easy peasy. But yeah, they had taken the walls down, taken the bed out and everything out, so. Some of the
Okay.
stuff that we dealt with, so.
Did they have a kitchen in there?
Yeah, they have
Was there
a,
the ability to cook food somewhere? in the
yeah,
facility?
in between, they have a little kitchen in between
In between the
there.
shower and
And
the
the-
bed.
And the crib and the non-working ice cream machine?
So
Yeah.
are they still in the camper in the back?
Well, I don't, the camper's there,
Okay,
I don't know, they said the plumbing was not working, so I don't know if they were living in there or
Okay.
what.
Yeah, and I told Carla to make sure she worked with building with that too,
But he
because
said
it
that
is
was a
kind of
police
like,
issue, so,
yeah, it's,
but I told him.
yeah, I said, I told you to work with them,
Yeah,
he says
yeah.
police issues. so
Larry
we told
also
police.
stopped by yesterday too, so.
Who
everything
owns
was
the
fine.
building? Do they own the building?
No, they don't, they're leasing the building.
Okay.
I think the gentleman that owns NASCAR's actually owns that building, and La Esquinita, which is down on the corner of Oxford and Yankee, owns the building, so he owns like 3 buildings. So I don't even know if he was aware of it, but, so anyway, that was good, they got it cleaned up.
So no showers in commercial kitchens?
No. Or living there,
Just to clarify.
that is a
Just
violation.
to make sure we're.
Yes. Also, we'll be looking at our, dog bite, policy. Janae was bitten by 2 dogs by the same owner last month. And then Sarah was bitten in April, releasing dogs from quarantine. So the way that Janae had gotten bitten was a child came to the door and the dogs just kind of, the parent was somewhere, this was a 3-year-old, 4-year-old child that answered the door or came to the door, and the dogs just kind of burst out the door. So we were kind of be looking at our policy to see what we can do to try to keep that from happening, although it's very, I'm not sure what we'll do, but.
that's a little.
And she knew we were coming, the lady knew we were coming and the time, so, I don't
Well,
know.
I told Carla, sometimes you need to say, we're on our way, make sure the dogs are secure. Often people let kids come to the door and whatever, you have to just reiterate all that because, and then maybe stay in the car and beep maybe before you get in there, or if you can call them before you get in the house, but most of them, the dog got away from kids.
What, yeah.
And often, I think more than bites, it's all the, when they jump up and the scratches too, because some of them been superficial, just like the scratch kind of thing, but.
Yeah, I think hers was, it looked worse than it probably was, but still to have gotten bitten, you know, that's, I think I jumped in a man's truck last year because of dog.
And it goes on top of.
A stranger's vehicle because a dog
She got
was
in it.
coming after me,
That
so.
she ran
With
up
him
to
in
a
it, you
stranger's
guys, with him
truck
in
and
it.
jumped into this
With
old
him in
man's
it.
car.
I
With the dog chasing.
Good
She
work.
just ran it.
Yeah. So, and I've been bitten twice also, but a couple of years back, but, yeah, so we need to look at that. And I think I really think we're as cautious as we could be. I mean, these are just fluke accidents, but it happens, so. That's it for me.
Okay. Anything else?
Real quick on your survey here, not your survey, but the summary that we give you every month, I highlighted areas that kind of disturb me, so I will be working with Chandra more. But all of these areas are preventable deaths. Now, you can't do everything, but with overdoses, you know, we do Narcan, but it's a lot of falls, motor vehicles more than normal, homicide and suicides, all of those can be addressed and looking deeper, so we'll maybe look at some of the programming as we go on. We worked so hard with COVID, right? So that we can then shift some of our time and energy and some directed programming to maybe help with these numbers. They have the Suicide Coalition, and they have different things that we can maybe start targeting some of our activities and our educational, moments, whether it's at the schools or whatever, so we're gonna start looking at some of these areas. We've had a hard year this year with homicides and even car accidents. That's been really bad. I mean, you don't usually get those, so we'll check and see what we can do, look a little deeper into them. But that's it.
Okay, well, we have a executive session with the personnel committee, and then we don't have anything else after that, so we'll make a motion to move to that, have our annual discussion with Jackie,
So I go out
and
first and then
then,
come in?
I don't think so,
Yeah.
no, you.
I can just stay?
Yeah, I
Okay.
think we were ready, I compiled everything last time, so.
Oh, okay.
And then we'll dismiss until September 12th at 7:30 a.m., hopefully with Emily present as well. So, do we have a motion, under the authority of ORC 121.22G1 to consider appointment, employment, dismissal, discipline, promotion, demotion, or compensation of a public employee or official?
So move.
Second.
All in favor?
Aye.
All opposed? Okay, so the personnel committee, can stay and we can chat with Jackie, everybody else is welcome to get on with their day, and we will